My name is Yelena Melyakova, but you can call me whatever you can say because my name had gone through lots of variations, from Melyakova to all sorts. My husband, for example, abbreviation for him at St. Joseph at Emory, where he still works, is Dr. Mel. So it's easy for them to say, but Melyakova is my last name. And you're welcome to practice and train until you learn. Anybody can learn that. First, I graduated from a geriatric fellowship with George Washington University and worked in several places. Most current was Emory University. I worked in geriatric clinic as a primary care geriatrician, taking care of patients older than 65 and enjoying it tremendously. Working with geriatric population is very rewarding, and I think that they are special in a way that each of them individually have their own story. They're people who already lived their life and they went through all sorts of experiences in their life, and they often are very willing to share that. Every time I hear a personal story, it is really impressive. In addition, of course, medically it is a very challenging but rewarding job as well. Growing older people tend to have a burden of chronic conditions, and managing multitude of chronic conditions so that the person still has quality of life and is able to continue living with dignity is a challenge. So I think this is part of geriatrics that really attracts me as a physician. Goal of geriatrics is to first ask the patient themselves what is their goal. You know, for some people it would be longevity, but not always. Often people say that the quality of life is way more important than longevity. The goal is to sit down and discuss priorities and see how do we come as members of society and also family members who care for this person. How do we orchestrate efforts to help this person age and remain happy? I did take a tour of the facility, and I think it's beautiful, absolutely beautiful. But what was most beautiful out of it were residents. I met with residents. I met with the board of the administrative board of Asbury Village, and on that board there were several residents who were absolutely enthusiastic, happy. They some of them were retired physicians, some of them were retired attorneys, and they really clearly expressed that they were happy in the place. And the goal of this clinic, I was very happy to hear, that was the same as any geriatrician would want it to be. It has to be equipped properly, it has to be answering needs of patients, elderly patients who have, for example, often they have need for equipment, they have need for special improvement in their home to make it safe, for example. They have need to have physical therapy and facilities like good library, facilities like where they could get together, meet and enjoy, and a physician will be part of it. We will work as a team. First of all, clinic is right there on the premises of the facility, so it takes away the need for transportation. Anybody can make appointment and literally walk there. Second of all, clinic is very well planned and built. There is plenty of room. There is pharmacy right there in the same building. So right after visiting physician, the patient can go to the pharmacy, pick up all the medications. They have physical therapy on the premises. So if somebody has had an unfortunate event like broken hip or just a fall, or they just need physical strengthening, everything is available right there. They have their own restaurant system, so they will be consulting with a physician in terms of nutrition, and I think that's a very important part of good living for elderly. So many things, and they have levels of care. People live there independently, If need comes, they can move to assisted living facility, and if need comes, they can go to nursing home. So with the physician being there all the time, there will be continuity of care for the patients, so they can graduate, so to speak, from being independent into needing more care and more care. And the physician will be right there with them. The same doctor with whom hopefully there will be great rapport and communication, and the family will be there as well to support. I've spoken with many patients, and often the worst fear of an older or aging person is to be a burden for their family, and they want to avoid it by all means. But the families are there for them, and it is very important for the patient to understand family is willing to help. It's not being a burden. However, the goal is to keep them independent as long as possible. With simple means, we can do that. Really, if somebody is, for example, suffering from arthritis and they need help in the morning getting out of the bed, ordering hospital bed could be a simple solution that can help them stay independent longer. Or ordering equipment like a cane or walker, getting physical therapy involved in time, and of course working with the family, building trust and understanding, and get as much help as we can from the family without the person feeling as a burden. This is very important. And all this can be orchestrated in a very delicate way, so that person benefits from support and would not feel as if they're imposing for the family. And so I think that's the goal.